You know that feeling when everything just clicks? Your mind is sharp, your mood is steady, your body feels like it's firing on all cylinders. That's not luck, that's what your body is capable of every single day. Now, I've looked into a lot of fish oil supplements, and honestly, most of them are mystery sourced, overprocessed, blasted with heat, and packed with synthetic add-ins. But this one is different. Omega-3 Rejuvenate from Big Bold Health starts with wild Alaskan salmon and cod, sustainably caught from some of the cleanest waters on the planet, and then it's processed at low temperatures to preserve what actually matters. We're talking about real omega-3s, naturally occurring vitamins A and D, and pro-resolving mediators, or PRMs, that help your body balance its own immune response. What does that mean for you? Clearer thinking, more stable mood, and real nature-based support for your heart and immune system. No shortcuts, no synthetic nonsense. And it was developed by Dr. Jeffrey Bland, a true pioneer in the world of complementary health. If you want to feel the difference, go to bigboldhealth.com/Hoffman. That's bigboldhealth.com/Hoffman and use code Hoffman for 20% off site-wide. Once you feel it, you'll know. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're going to focus on a very specific subject, which is the relationship between coffee, caffeinated beverages, and heart health. Now, I'm old enough to remember that there once were commercials where a Dr. Marcus Welby, portrayed by the actor Robert Young, used to make house calls on harried housewives, advising them to quit drinking that jangling coffee and switch to a healthier alternative. It had the imprimatur of medical advice that decaffeinated coffee, Sanka, which is a little bit like dishwater back in the 70s and early 80s, that this was a preferable alternative. And to some extent, that was the position that the American Heart Association has taken for decades. And yet, in a dramatic turnaround, they've, to some extent, vindicated coffee as a culprit in heart problems. So today we're going to talk to an expert. He's Dr. Gregory Marcus. He's an MD, and he's a cardiologist, and he's also an electrophysiologist, which means he knows a thing or two about palpitations. Electrophysiologists deal with patients who have arrhythmias, in particular atrial fibrillation. And it was long thought that, logically enough, coffee is a stimulant. It kind of makes you feel speedy. It could prompt arrhythmias, and, that could be taking you down the course towards medication or having the need for cardiac ablation, which is actually something that he specializes in. So he is chair of the Scientific Statement Writing Group of the American Heart Association. That sounds kind of official, Dr. Marcus, right?
It was indeed official, a multi-step process full of a lot of peer review, so making it a rigorous statement that incorporated input from really experts from around the world on the subject.
Indeed. So give us a little background, because how did coffee acquire its reputation as being something bad for heart health?
Yeah, so just to make sure we're not disparaging Marcus Welby too much, I have to mention that, oftentimes when I introduce myself to patients for the first time and they say, what's your name again? And I say, Dr. Marcus, like Marcus Welby.
Okay.
Like, okay, yeah, now I know what your name is. So as you mentioned, there's this intuition that because caffeine tends to ramp up our sympathetic nervous system, that being the side of our nervous system that has to do with adrenaline, that may be harmful, and especially might increase the risk for abnormal heart rhythm disorders. And so it has long been conventional wisdom that caffeinated coffee, if anything, only increase the risk for various forms of heart disease. But it turns out that when you look at actual evidence, studies that have been done, it's not that simple. I wouldn't go so far as to say that, well, it's a panacea, it's definitely good for you, it's always healthy, and hopefully we can dig into this. I think some of the challenges arise because there are many forms of heart disease, and it may be that the same substance, in this case caffeine, has some benefits for some of those outcomes, but maybe can be harmful in other cases. There's a tremendous heterogeneity in terms of how we all handle caffeine. We are all born with genetic variants that determine how fast or how slow we metabolize caffeine. So you give two different people the same amount of caffeinated coffee, you will, and then measure their caffeine in their bloodstream an hour later, you will almost certainly find very different concentrations of caffeine. And then finally, different people also have variable propensities to things. We all, again, have our own intrinsic propensity to high blood pressure, low blood pressure, to heart attack, to heart failure, to some of these rhythm disturbances you mentioned, like atrial fibrillation. So this all contributes to the complexity, of understanding this relationship. And actually, one more point here, which is that the study design also matters a lot. And this was a major focus of this statement, to try to provide some insight into how the nature of the study or the scientific process that was employed for various studies itself is important in terms of understanding relevant limitations, how reliable that information is. The great majority of research on caffeine, as is the case for almost any lifestyle factor, so we can apply the same to alcohol, to cannabis, etc., is of a sort that we describe as observational, as opposed to interventional or experimental. Observational studies are relatively easier to do. They're more feasible. Therefore, there's a lot more of them. And in those studies, we identify a group of people, for example, that drink variable amounts of caffeinated coffee, or those that do and don't, and then follow them over time and see what happens. And you can make some inferences. You can identify associations between caffeinated coffee and those outcomes. The problem is that there is almost certainly always some other factor or factors that likely confounds that relationship. Mm-hmm. There's a reason that some of those people are consuming coffee or variable amounts of coffee, and maybe that's the reason that they have more or less of a given outcome.
You know, Dr. Marcus, I've always looked at some of these studies that suggest that people who drink up to 5 cups of coffee per day are generally healthier, and they have better heart health. But I ask myself, like, if you're able to consume 5 cups of caffeinated coffee per day, you're probably healthier and more robust and less fragile and frail than someone who says, "Oh my goodness, coffee puts me into a tizzy."
Yeah, you can also afford the coffee. You can also take the time during the day to be drinking the coffee.
It's a sign. It's a sign of it's a mark of affluence, especially with the cost of coffee these days.
Yes, it may be, and almost certainly, incidentally, those people are probably fast metabolizers. Mm-hmm. Probably have genetic variants that lead to them metabolizing their caffeine more quickly. So so we can adjust statistically for those other factors, but that presupposes we know what those factors are, and we often don't really know what the true confounders are. And even if we do, it also assumes we are capturing them accurately, that we're measuring them well. The best way to mitigate against this confounding issue is to do a randomized trial. And we now benefit from a couple of randomized trials, or several now randomized trials, a couple of them of caffeinated coffee itself in ambulatory participants that we can talk about.
But wouldn't that be hard to do, because you'd have to observe people over years and perhaps decades and make sure they're really complying, that the control group was having 0 coffee and that the active group was, diligently consuming whatever the allotted amount of caffeinated coffee that there had to be. So it's hard to do studies like that.
It is hard. It's expensive. It's resource intensive. You bring up two limitations. One is the compliance. How do you know they're going to follow their randomization assignment? Now, if they're not compliant, presumably that's going to reduce the power to detect a relationship and shouldn't lead to a false positive, right?
Okay.
Presumably it's going to be the people that are drinking coffee when they're instructed not to do so. And then the other
even
issue
what you're saying is,
yeah.
even if there's a so-so effect, it actually is more significant because maybe there's a little bit of crossover between the groups. And if you really see a distinction, that is pretty significant. Yeah.
So the reduced power means it increases the chance of a false negative, but does not increase the chance for a false positive.
Okay.
And if anything, as you say, it suggests that if you see a significant or a statistically significant difference, maybe the true difference is even greater than what you observe.
Okay.
Another point you bring up there, a limitation, is the issue of a long-term trial and long-term effects. And that's a really tough one. So just to give you some examples of studies that have been done. So one was a randomized trial called CRAVE, coffee in real-time atrial and ventricular ectopy. Ectopy meaning early heartbeats, atrial coming from the upper chamber of the heart. Those beats are known to be a predictor of atrial fibrillation, the most common arrhythmia we see.
Skip beats, when people notice like kind of a heart, like a skip beat, it's actually noticeable. A lot of people sense these things.
Indeed. And then if it's coming from the lower chamber, a skip beat from the lower chamber is a PVC, premature ventricular contraction. These can be bothersome. We all have these, by the way. Sometimes I don't want to worry any listeners. It's quite normal, in fact, to feel them once in a while. But if you have a lot of them, that could be a predictor of a future issue. And then some people are really bothered by them, whereas others don't feel it at all. So in CRAVE, caffeinated coffee consumers were randomly assigned to consume versus avoid caffeinated coffee on a day-to-day basis. So you could not comment on the long-term chronic effects, but you could look at short-term acute effects. To answer the question of, well, how do you know they were really following their randomization assignment? That was assessed in a few ways. So one, these participants were wearing a continuously recording EKG device that had a button they could press, and they were instructed to press the button whenever they had a cup of coffee. So at least it was real time, so there was no recall bias, something we always worry about when you ask someone.
Yeah, like you ask people, when did you have coffee yesterday? Like, I don't know.
Right, exactly. In this study, they were also geofenced based on their geolocation from their smartphone for visits to coffee shops.
Okay.
And it turned out that days randomly assigned to caffeinated coffee, they were more likely to go to a coffee shop. Finally, they were also all told that their caffeinated coffee would be reimbursed, would be paid for by the study, as whether they were supposed to drink it or not, importantly, as long as they provided a date-stamped receipt. So they were incentivized to provide these receipts, and it turns out that the great majority of the time they were following their instructions. And interestingly, there was no difference in the early beats coming from the upper chambers, the premature atrial contractions, which fits with this idea that it doesn't seem to increase the risk for atrial arrhythmias like atrial fibrillation. And we can talk about another trial that showed a potential protective effect on atrial fibrillation. But a really important caveat, and one that I want to make sure we get out there in terms of the flip side, the potentially still harmful side, is there were more premature ventricular contractions, or PVCs, on the days when people were randomly assigned to consume caffeinated coffee. And it turned out if you looked at those button presses, even independent of the randomization assignment, the more cups of coffee they had, the more PVCs they had. So it may very well be that caffeine or caffeinated coffee can be antiarrhythmic, protective, helpful for some rhythm disturbances like atrial fibrillation, but even at the same time be harmful, increase the risk for premature ventricular contractions.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here we go. Please listen up.
Has your digestive health been striking out due to poor food choices, medications, stress, and other lifestyle issues? This season, hit a home run for your digestive health with Dr. Ohhira's Probiotics. Dr. Ohhira's Probiotics is a live probiotic encapsulated in small, easy-to-swallow capsules that delivers Dr. Ohhira's signature blend of pre, pro, and postbiotics. Dr. Ohhira's award-winning formula contains a prebiotic blend of fruits and vegetables, which are naturally fermented with 13 strains of live probiotic bacteria for a minimum of 3 years. The result? Dr. Ohhira's game-changing postbiotic metabolites, which are key to supporting long-term digestive, immune, and cognitive function. Dr. Ohhira's Probiotics, an all-star formulation and the best probiotic on the market today for overall digestive health and wellness. Dr. Ohhira's Probiotics, available at Sprouts, Natural Grocers, and other natural health retailers nationwide.
Thanks for listening, and thanks for supporting our sponsors. And now back to today's guest, Dr. Gregory Marcus. So, are there any studies on decaffeinated coffee? I have a personal interest in this because I guzzle decaffeinated coffee, which does deliver, minimal amounts of caffeine. I'm not kidding myself, but, generally it mitigates the caffeine effect. But I believe that there's some studies that show beneficial health effects for consumers of decaf as well.
Yes, there are. And this points out this another difficult issue with many of these studies, which is it's difficult, if not impossible, to disentangle effects that might be due to the caffeine versus due to other parts of coffee, other constituents that may have beneficial effects, maybe as antioxidants, anti-inflammatory agents. And there aren't really good randomized trials of decaffeinated coffee, but there are those observational studies. And as you allude to, there is some evidence that those who consume caffeinated coffee do seem to enjoy a lower risk of several forms.
I think you meant to say decaffeinated coffee.
Sorry, decaffeinated coffee.
Okay. Yeah.
Those who consume for both, but also for people who consume decaffeinated coffee seem to have a lower risk of various forms of heart disease.
Indeed. Okay, so and let's double click on that because a lot of people, it's good for the heart or bad for the heart, but there are different constituents to the heart. One type of heart problem is what you focus on, which is cardiac arrhythmias, atrial fibrillation, VTAC, and VFib, whatever, all those bad things that can actually cause you to sudden death. Yeah. But there's also other types of cardiovascular disease. There's arterial disease, and then there's congestive heart failure. Kind of a pump failure. Valvular. So it may be that there are differential effects in terms of these different constituents of the heart.
Yeah. And so one way that we in the scientific statement divided it up, and I can address each of those because they are quite distinct, although at the same time they are interrelated in some ways because as one can increase the risk for the other. But there are cardiovascular risk factors. So we focused in that category on blood pressure or hypertension, that being high blood pressure, and diabetes. The data there is fairly consistent. And again, this is really all based on predominantly observational studies. Those who consume caffeinated coffee seem to be at lower risk of developing diabetes, interestingly, type 2 diabetes. The relationship with blood pressure is more complicated than one might think.
Yeah, because from what I learned, basic physiology, a couple of substances that we get hooked on and use frequently recreationally, caffeine and nicotine, are vasoconstrictors. They cause the blood vessels to clamp down. So how could something, you consume a lot of coffee, it does have the potential to raise your blood pressure, which hence could be bad for the heart.
Yeah, so caffeine, just to take a step back and talk a little bit about the mechanism, has multiple effects. So it most famously, and I think what's experienced we've already referred to, which is this adrenaline effect, the sympathetic tone effect. Generally, sympathetic tone does indeed tend to vasoconstrict blood vessels, tends to increase heart rate. Both of those things increase blood pressure. Caffeine, though, is not simply increasing sympathetic tone or increasing adrenaline. One of the things of many that it does is it works on what we would call like a second messenger. So inside the cell, it is setting off processes that are the same as those kicked off by adrenaline. So it's not necessarily just increasing adrenaline. And it turns out that when you do that, yes, you increase heart rate and you may constrict some blood vessels, but you're probably dilating some other blood vessels.
Okay.
We know, for example, that it dilates bronchioles. Those are not blood vessels, but those are in the airway, especially theophylline, which is a important metabolite of caffeine.
This is an old trick. If you're stuck without your asthma medication and you're having an asthma attack, drink a strong cup of tea.
Yeah, right. Or coffee. Yeah, caffeine will be metabolized to theophylline that can dilate these bronchioles. Other things it does, it makes us pee, as people may know. And so we are, when we're doing that, we are losing salt and water. Others may also know that such diuretics, things that we know make us lose salt and water, tend to lower our blood pressure because they lower our blood volume. So it may be, again, this comes back to the individual propensities. Some people who have high blood pressure, for example, are thought to have more of what is sometimes referred to as salt sensitive high blood pressure, meaning their tank is too full. They have too much blood volume. And if you reduce that, you can help with their blood pressure. Other people probably have a more vasoconstrictive sort of blood pressure, and maybe caffeine for them is not going to be so good. The data in the general population is, interestingly, what's been described as an inverse J, meaning at low levels, it seems to increase blood pressure, but at higher levels over a longer period of time actually reduces blood pressure. Maybe that's the diuretic effect. Another thing that was found in that CRAVE trial I talked about, where people were randomly assigned to consume versus avoid coffee, they were also wearing Fitbits. And it was found that on caffeine consumption days, they took on average 1,000 more steps.
Okay.
So
it's like a motivator, works on the brain, gets you going, maybe initiates more physical activity, which ultimately may be a source of the benefits of caffeine, is that,
Exactly.
not the caffeine per se, but what it makes you do.
That's right. And over time, people who are more physically active, everything else being the same, their blood pressure is going to be lower. So it may protect against blood pressure in that sense.
I wanted to circle back on that diuretic effect, though, because there's a little bit of urban lore about, don't drink coffee on hot days because it's going to dehydrate you. And I think that's been debunked, is that, yes, it is a bit of a diuretic, but the net effect is that any form of liquid, H2O, whether it's flavored or not, it's going to hydrate you. Perhaps unlike alcohol, because I think, drinking alcohol, especially strong liquor, is going to dehydrate you. It's not the answer to a hot day.
Yeah. I am not convinced that is a myth. I actually do think it's better. I always tell my patients, for example, don't count your caffeinated drink as fluid intake. Assume it's a little negative or nothing.
Interesting.
And in fact, in many of my heart rhythm disorder patients, when I ask them about caffeine, it's more because of that, because some patients feel faint, for example, when they are more dehydrated, they need to fill the tank, as it were. And for those patients, I think caffeine may not be helpful.
And it might deplete you of electrolytes. That's also a possibility.
Yes.
Okay. All right. So that's interesting. But the less of that effect with decaf.
Correct. That's right. That's right. So a decaffeinated coffee, you are almost certainly holding on to more of the fluid that it brings with it. So in terms of the other kind of harder endpoints of various forms of heart disease, just to go through what the data shows, and again, most of this is observational, so could be confounded, but the available evidence suggests that people who consume caffeine on a regular basis, and it just so happens that this tends to be coffee because that's the most commonly consumed caffeinated substance in the US and therefore the most commonly studied. Risks for heart attack, which is a blockage, an abrupt blockage in a blood vessel providing blood and oxygen to the heart, tend to be lower among people who consume caffeinated coffee. risk for stroke, same thing, but regarding blood vessels getting abruptly clogged, going to the brain. Also, lower risk with caffeinated coffee. As we talked about atrial fibrillation, the observational evidence, and again, atrial fibrillation is the most common abnormal heart rhythm disturbance that we see. It can lead to heart failure. It can lead to stroke. Here we have observational data and a randomized trial. So in the randomized trial, people with atrial fibrillation scheduled to undergo a cardioversion procedure, they're going to be shocked out of their atrial fibrillation back to normal, were randomly assigned to either for 6 months try to drink about a cup of coffee or more caffeinated coffee a day versus try to avoid all coffee and caffeine. The group randomly assigned to the caffeinated coffee actually had less atrial fibrillation.
Was that a surprise to researchers? I would imagine that might have been surprising, or unless people had already formulated the theory that maybe, just maybe, there's a protective effect.
Well, so it was somewhat of a surprise, and I only say it was somewhat because there had already been observational data that people who consumed caffeinated coffee seemed to experience a lower risk for atrial fibrillation. We had assumed that there must have been confounding there. And so in that sense, yes, we were surprised to see this. There are actually several reasons why that might happen.
I was going to get to that. And as an electrophysiologist, you may have some insight. I'm going to tell you what, as a generalist, what I think. I think one of the reasons for runaway heartbeats is when there's a pause that the heart thinks it needs to catch up and then add some rapid beats. And I think that if you're taking a little caffeine, there may be less pauses, which regularizes the heart rhythm. Am I on track with that theory?
A little, perhaps.
Okay.
So we talked about how within cardiology, there are these different forms of disease. Within my little thimble of a subspecialty of electrophysiology, heart rhythm disturbances, the heart rhythm disturbances themselves are very, very distinct from one another. We already talked about the atrial fibrillation coming from the upper chamber versus early beats coming from the lower chamber and maybe having discordant effects with caffeine. So specific to atrial fibrillation, it turns out that many people who have that common rhythm disturbance tend to get it when they have more vagal tone, more parasympathetic tone. So more, it wakes them from sleep. Right. They have it after a big meal. I even have some patients.
But that's a slowdown phenomenon, actually.
Correct.
Yeah.
That's right. The heart rate tends to slow and then they go into atrial fibrillation.
Okay.
I have some patients who, to get out of atrial fibrillation, will do push-ups and they'll terminate or they'll run up a hill to get out of AFib. So it may be that by ramping up the sympathetic side, the adrenaline side, that protects against AFib. There's another, and we already talked about the diuretic effect. Maybe it's by lowering blood pressure that protects against AFib. More physical activity we talked about could protect against AFib. There is another potential explanation, which is, so another separate mechanism of caffeine is that it blocks a molecule called adenosine, which is something we all take in our bodies.
Which is kind of the tired chemical. And when it accumulates, you feel tired.
Exactly. So this is how caffeine prevents us from feeling sleepy. So importantly, caffeine does not reduce our need for sleep. It just reduces the perception of sleepiness, as you say, because it's blocking adenosine. Now, it turns out that for medicinal purposes, we sometimes administer adenosine on purpose for various reasons because of its effect on the heart. But we know that adenosine can actually trigger atrial fibrillation.
Okay.
And so perhaps by blocking adenosine, we're protecting against atrial fibrillation.
Interesting. Okay.
Now, the one other important heart outcome that we haven't talked about yet is heart failure. You talk about congestive heart failure. So this is when the heart becomes weak, when fluid builds up in the lungs. Can we tease to that subject for part 2, because our listeners know we divide our podcast into 2 parts. We've got plenty of time to discuss other heart-related problems, and I want to also get into some other variations on the theme. And for whom caffeine may not be such a great idea. I'm sure when you're advising patients, you're selective about this. You're not making a blanket recommendation based on this new press release by the American Heart Association.
And also, we distinguish the delivery system for the caffeine. There's a lot of caffeinated drinks, energy drinks abound, and they deliver just whopping amounts of caffeine without potentially the side benefits of other helpful compounds in coffee. We'll talk a little bit about that in part two. Our guest is an expert on the subject. He deals with heart palpitations all day long. He is a cardiologist and an electrophysiologist. We'll talk a little bit about what an electrophysiologist does day to day and how the latest treatments may offer you a pathway towards relief from cardiac arrhythmias, which is his specialty. Dr. Gregory Marcus, and this is in wake of a new policy statement by the American Heart Association that to some extent vindicates coffee as a culprit in heart disease, but we need to take a more nuanced approach to that. It's not a blanket recommendation. When we return, we'll drill down. I'm Dr. Ronald Hoffman, and this is the Intelligent Medicine Podcast.